Let's talk about schizophrenia with leading psychiatrist.
Hello, everybody. My name is Dr. Wilona Braganza. I am a psychiatrist practicing in Mumbai, Maharashtra. Today, I'm going to speak about the early signs of schizophrenia and how to cope with them. Schizophrenia is a condition that usually starts surfacing after puberty hits. And most people are diagnosed in their late teens to early 30s. I know that the diagnosis of schizophrenia can be really hard because people with schizophrenia often do not even realize that they are ill, and they often do not visit the doctor for help. In my OPD, it's the family members that usually bring the patient for help. Another challenge is that many of the changes associated with schizophrenia can appear like normal life. So like a teenager who is in the early stages of schizophrenia might just simply drop his group of friends, stop trying to make new friends. They may have trouble sleeping, or they may start coming home with poor grades. They may lose their focus in academics. They may lose their interest in doing things that they would otherwise enjoy. And they might actually withdraw from their usual routine. In the early phase of schizophrenia, a person may appear eccentric, unmotivated, not feeling any emotion, and actually reclusive to others. And one of the first few symptoms include isolating yourself from others, neglecting your own personal care, saying odd, peculiar, weird things, and generally showing an indifference to life. Very often, these symptoms are missed as odd behavior or weird behavior, and they're put down to a change in academics or a major loss in friendships or a romantic disappointment that the person has felt. And that is why very often signs of schizophrenia are not picked up early. Unfortunately, one of the things that we have realized is the earlier the illness is picked up, the better the chances of recovery for the person. And so I often feel that if patients come in early stages, we can catch it early and halt the progression over a period of time. Some of the common early signs with schizophrenia are feeling depressed, withdrawing from social life. Sometimes people can experience a lot of suspiciousness, hostility, irritability, or anger, an extreme reaction to criticism. So they may not at all be willing to accept or take any critical comments, a deterioration in personal hygiene. So I've seen patients with schizophrenia really struggling with waking up in the morning and performing basic tasks like brushing their teeth, taking a bath, getting ready for the day. Often my patients come back and tell me, "Doc, even for your appointment, I struggle with waking up and, getting ready. So now that it's online, I just have to show you my face. And so I just make sure to put on something that looks decently presentable and meet you in the." Sometimes patients can have oversleeping or, on the other end, insomnia. They may find it difficult they may find themselves having a difficulty in concentrating, and they may have a strange use of words or a very odd, eccentric way of speaking. I know the diagnosis of schizophrenia is really difficult to digest because I have a lot of people that come to me in the early stages that are coming with this expectation that please let it not be schizophrenia. They've Googled the signs and symptoms, they've seen the challenges, and they come to me with the idea that kuch bhi ho, let it not be schizophrenia. But ignoring the problem won't make it go away, right? The treatment of schizophrenia has to begin as soon as possible with an experienced mental health professional. And this is one of the most crucial steps to recovery. With early diagnosis, the right treatment, and the right amount of help, both professional as well as self-help, many people with schizophrenia can actually attain normal functioning and become symptom-free. I hope this helps you. Thank you and have a good day.